Hi, my name is Loretta and I'm from the Parentmedic movement. Today I'm going to talk about fever and what to do, so the signs of a fever, how to treat the fever and where to seek more help. Fever, which is a high temperature, is common in children. Fever is a normal response to many illnesses, the most common being an infection in the body. Fever itself is usually not harmful. In fact, it helps the body's immune system fight off infection. While fevers can be concerning for parents, doctors will usually be more concerned about what is causing the fever and not what your child's temperature is. It is more important for you to monitor any signs of the underlying illness rather than the fever itself. So if your child seems well and is happy, there is no need to treat that fever. The signs to look out for are your child has a fever when their temperature reads above 38 degrees on a thermometer, but you don't need a thermometer. Some of the things to look out for is your child is unwell or hot to touch, irritable or crying, more sleepy than usual, vomiting or refusing to drink, shivering, or in pain. If your baby is under 3 months of age and has a fever above 38 degrees, then you should see a doctor, even if they have no symptoms. If your child is over 3 months of age, only use medicines such as paracetamol for relieving pain, and if your child is irritable. Don't use the medication to reduce the temperature. Give your child frequent small drinks, as many children refuse to eat when they have a fever or they're feeling unwell. This is not a problem as long as they stay hydrated. If your child is under 6 months of age and you are breastfeeding, offer extra breastfeeds, and if you are formula feeding, offer the usual amount of formula. If your baby is older than 6 months, keep breastfeeding or bottle feeding. You can also offer your child water or oral rehydration solutions which are available from your pharmacy. Dress your child in enough clothing so that they are not too hot and not too cold. If your child is shivering, add another layer of clothing or a blanket until they stop. Do not try to reduce the temperature by cooling their child, as cold baths and showers are not recommended. Just make sure your child is comfortable. The red flags to look out for when your child has a fever are reduced wet nappies, not eating and drinking, and irritable. They're vomiting and refusing to drink, more sleepy than usual, fever with difficulty breathing, fever with a rash or sensitivity to life or a stiff neck, or they seem to be getting worse or have a prolonged fever. For more information on this topic, please visit www.parentmedic.co and head to the blog.